Hello to all of you, my dear students. In this part, we're going to talk about blood sugar medical tests. As you've watched the previous video, we discussed about carbohydrates and different conditions of sugar existing in blood. So let's go to talk about tests. The most common test to evaluate the state of blood glucose regulation is to measure it directly in a plasma or serum sample. In the past, the name blood sugar, please pay attention, blood sugar, BS. BS is abbreviated of blood sugar, was used to refer to this test, and this name is still widely used. Sorry. And word blood sugar isn't really correct because since in this test, glucose and not other sugars. Glucose, okay, not other sugars. Other sugars like fructose, galactose, maltose, and some monosaccharides and polysaccharides. Sugars are measured, and for this measurement, a sample of serum or plasma and not whole blood. Not whole blood, because blood is contains of three parts. The main part is RBCs, white BCs, and platelets, and the second part is plasma or serum. It is more appropriate to use the name plasma glucose PG or serum glucose SG. Okay, so you see FBS in the checkup result paper more than FPG because FBS is much more common. Okay. When the random plasma or serum glucose is equal, pay attention, is equal to or more than 200 milligram per deciliter, and the patient has the symptoms of diabetes mellitus. The symptoms of diabetes mellitus, we've talked about it, like polyphagia, polydipsia, and polyuria. Okay, the diagnosis of diabetes mellitus is made when a person has a serious illness. The test result is not reliable for the diagnosis. The results of random plasma glucose less than 140 milligram per deciliter rejects the presence of diabetes. Okay, so next slide. The most common test to diagnose diabetes in measuring fasting plasma glucose, FPG, is fasting after 8 to 16 hours, which is wrongly fasting blood sugar, or FBS. Okay. The previous separation limit for distinguishing healthy people from sick people was 110 milligram per deciliter glucose, which was reduced to 100 milligram per deciliter. Therefore, patients are placed in three groups, three categories, based on FPG results. Number one, the first category is normal people. Normal people have results less than 100 milligram per deciliter. The second one is diabetic people. And the last one is individual with impaired fasting glucose, IFG, results between 100 and 125 milligram per deciliter. Diabetic people have results equal. Sorry, I missed that. Diabetic people have results equal to or higher than 126 milligram per deciliter. Okay, this categorized algorithm help us to look for diabetic people from normal people and to treat them. These categorizing. Okay, when a person is diagnosed with diabetes, it is necessary to perform a serum or plasma glucose test at different times after consuming a meal. Okay, in this test, the most common form of testing is 2 hours after breakfast, 2 HPP. 2 HPP is abbreviated of 2-hour postprandial test. Okay, 2 HPP. In glucose tolerance test, a solution with a certain amount of glucose, for example, 100 gram glucose or 50 gram glucose or 75 gram glucose, it is different, is given to the patient to drink within 5 minutes. And under certain conditions, and under certain conditions. Then at specific time intervals, like after 1 hour, after 1 hour after drinking, 2 hours after drinking, and 3 hours after drinking, venous blood samples are taken. Venous blood samples are taken from the patient in order to examine the changes in serum or plasma glucose level. Okay, so glucose tolerance tests are most commonly used in the diagnosis of type 2 diabetes and gestational diabetes mellitus, which is searching pregnancy period. Okay, so the purpose of measuring GGT is in the diagnosis of type 2 diabetes and gestational diabetes mellitus, or GDM. Okay, so it is use of oral glucose tolerance tests, or OGTT or GTT, usually for diagnosing type 2 diabetes, not type 1 diabetes. Okay, or all different categories of diabetes, just type 2 diabetes. Based on the glucose level 2 hours after drinking the glucose solution, patients are categorized in three groups. In a normal person, the level of glucose is less than 140 milligram per deciliter. In a diabetic person, the level of plasma glucose is equal to or more than 200 milligram per deciliter. And in the last category is when the plasma glucose level equals to or exceeds 140 milligram per deciliter, but less than 200 milligram per deciliter. I mean, in the range of 140 and 200. The person has impaired glucose tolerance, or IGT. Okay, impaired glucose tolerance, or IGT. We have another measurement method called glycation. Okay, glycation means the non-enzymatic attachment of sugar compounds to proteins like hemoglobin, like albumin, which is the most frequent protein in our blood or in our serum. The extent of which is affected by the amount of sugar compounds present and the life of the protein. Okay. Glycation blood proteins mainly include hemoglobin under the title of HbA1c, okay, and albumin under the title of fructose amine, along with the production of products that measure the amounts to diagnose and monitor diabetes. Okay, so glycated hemoglobin results from the binding of sugar compounds to the amino acids in the alpha and beta chains in hemoglobin. As you know, hemoglobin has two pairs, one pair of alpha chains and one pair of beta chains. Okay, in the usual case, this connection is made to the valine residue. Valine is an amino acid, is a polar amino acid, actually, I think, of the amino acid end of chain beta, which causes an increase in the negative charge of glycated hemoglobin molecules. Okay, so hemoglobin A1c, or HbA1c, Hb is abbreviated of hemoglobin, is the main form of HbA1 in the blood circulation, in which glucose is a carbohydrate attached to the valine residue of the beta chain. Okay, and it contains about 80% of the total amount of HbA1. But besides HbA1c, we have some HbA1s like fructose 1,6-bisphosphate, or HbA1a1. The second one is glucose 6-phosphate, HbA1a2, and pyruvate, HbA1, which is the product of glycolysis, which we are gonna talk about it very, very deeply. Okay, pyruvate. Actually, using of HbA1c has a lot of advantages. Okay. Sorry. Uh, I have to say there are some conditions. There are some conditions which may affect on the HbA1c values. Like the interpretation of HbA1c measurement results is dependent on the lifespan of RBCs. Is dependent on the lifespan of RBCs. Patients with hemolytic anemia, okay, or other conditions of reduction RBCs are life-giving and have lower HbA1c values. During pregnancy, due to the dilution of the RBCs, HbA1c level decreases approximately 0.5%. Okay, so next slide. In patients with iron, folate, and cobalamin deficiency, folate is a is a branch of vitamin B9 or folic acid, and cobalamin is vitamin B12. Okay, we have different types of vitamin B12 like cyanocobalamin or methylcobalamin or something like this. Okay, deficiency. Higher HbA1c values have been reported. People who have recently lost a lot of blood because replacement of lost blood with young RBCs have lower HbA1c values. Okay, so I have to say, actually using HbA1c has a lot of advantages. The advantages of using HbA1c in the diagnosis of diabetes are no need for fasting. The most important and the most application of this test is no need for fasting, less intra-individual variability compared to FBS and GTT. And the third one is better glucose control reflection in the last 2 and 3 months. Okay, this test in population where the prevalence of hemoglobinopathies, okay, like sickle cell anemia, okay, which is very common in Africa, okay, due to malaria, are high, or in situations where the renewal of RBC is not suitable. It is clear. Okay, so the serum fructose amine. Okay, serum fructose amines resulting from non-enzymatic, exactly like hemoglobin, from non-enzymatic glycation of protein serum, especially albumin. Albumin is the most frequent and the most amount of protein in our serum is albumin, and for this reason they are also called glycated albumin. Okay, glycated albumin, because the half-life of serum albumin is much shorter, between 2 to 3 weeks or 14 to 21 days, than hemoglobin. Fructose amine is generally a measure of the state of glycemic control over the past 2 to 3 weeks. Okay, advantages of using the fructose amine test over the HbA1c tests are assessment of midterm glycemic control. The second one is lack of influence of hemoglobinopathies, okay, and hemolytic anemias on its values. And the third one is facilitating the testing using serum samples. Okay, these are the advantages of fructose amine. Despite the above advantages, in most cases, glycohemoglobin tests remain the preferred method for evaluating long-term glycemic control in diabetic patients. Actually, there are very great advantages of fructose amine, but still nowadays we use HbA1c to evaluate the serum glucose in the past 2 to 3 months than fructose amine. Okay, so Thank you very much to be with me till the last minute of the class. Blood sugar subject has finished. Blood sugar has finished in just only 2 videos. And I hope you've learned a lot and gained lots of info about blood sugar. Don't forget to like my videos if you like it, and subscribe to my channel. Thank you very much, and I love you very much. Goodbye. Ciao.